Rocket Health is a digital health and telemedicine company that provides end-to-end services that incorporate teleconsultation, so people can be able to call and chat with a medical professional from the comfort of their home or office. We also do last mile delivery of diagnostic services, so someone comes out to pick samples from you, we process them from the lab, and then results are sent to you and the doctor calls to explain the results. We then also do last mile delivery of medicine, so you don't have to come to line up and pick your medicine. And in addition to this, we have physical clinics where people that cannot be fully catered for remotely are able to come in and get a physical assessment. So private players like Rocket Health contribute a lot to healthcare. In Uganda, more than 50% of people still seek healthcare out of private players. And so any support that goes to public health institutions should also perhaps go to support private health players, so that we build the rails and the foundations on which everyone can be able to access healthcare in a more equitable and affordable manner. So I think it's not one way, you can't learn from the other, so it's two way. I think we need to learn from each other, and I think one of the ways that we can learn from each other is how to better use data and the insights we get from the clinical aspects of the work that we do to inform how that improves public health and global health in general. And I think that's something that not only Africa should do, not only Europe should do, but all the continents should work together to see how they better use the data that they collect to inform global health. So the COVID pandemic accelerated the way people perceived telemedicine and digital health in Africa, most especially in Uganda. And so what happens is that we saw uptake of our services by more than 500%, 800% in certain aspects. And we hope that this adoption and growth will stick even after the pandemic, because the lessons learned, the experiences from deploying these digital tools are very much needed even in the day-to-day healthcare beyond the COVID pandemic. So of course, access to financing to build long-term foundational rails on which digital health and telemedicine is going to be seen and is going to be applied in the years to come is still a major problem. A lot of the available funding is project-based, which means that it's available for a short time, and then after that there's no complementary resources to build this out for a long time. So that's still a major problem. Of course, there's a challenge of access to the adequate human resource and skilled labor to do a lot of the things that are needed to improve and advance digital health in Africa. But those are things that are improving year by year, and we think that in the coming years it's going to be a better situation both in the funding area and also in the human resource area. I think for us it's the way technology has helped to break barriers to accessing healthcare and also to bring equity. So I'll give you an example that previously a lot of people needed permission from either their husbands or their spouses or people that take care of them to access some sexual and reproductive health care, to access different services from hospitals. Right now, once you own a phone or have access to a phone, you're able to actually just call and be able to speak to a doctor, get as much information about how you need to manage your health and take care of yourself. And I think for us that's a very big win that we see that technology has brought to the healthcare space, and we hope that that continues across the different healthcare domains. I think it's collaboration, and looking at things in a holistic manner. And I think if there's anything that we learned from the COVID situation, it's that the more we work together, the more we share insights, the more we share lessons, the more we share failures, the better we all get, even our individual national healthcare systems. And that's the recurring sentiment that I keep getting from all the sessions that I attend: collaboration, collaboration, collaboration. One of the things is everyone keeps talking about the use of data, but the availability of the resources and the technology is not equally distributed in different places. So it might be that certain places like Europe or the US have access to some data and some others are not. That means that there will be some biases in the way things like data in healthcare is being used, and if this is perpetuated and applied for a long time, it will create more inequalities. And we think that the opportunity is to engage a lot of the local players across the world, even in the areas that are not well represented, especially when it comes to data, to have more input, more resources to be able to produce structured data that contributes to the global conversation. And in that way, we think that that will improve everyone's contribution to equitable healthcare.